Hi, I'm Phil Odom.
And I'm Steve Strobridge.
And this is MOAA Focus, and we're back to talking about the National Commission on Fiscal Reform, or the Debt Commission. Steve, what I really want to talk about today is what are the growing portions of the national debt? Where are those costs rising? I understand the interest right now that we're paying on the national debt, which is both private and public altogether, is about 1%.
Well, the interest on the national debt is 1% of gross domestic product. You know, a lot of people, what's gross domestic product, GDP? Well, that's the value of all the goods and services put out by the country. A lot of people have trouble understanding that. It's a little easier, I think, to talk about it in terms of what percentage of tax revenue does that take up? Well, if interest goes to 4% of GDP, that's going to eat up 1 out of every 6 tax dollars. 16% of taxes go just to interest on the national debt, not paying for anything else that's really productive for the country. You add to that the Social Security issue. Right now, Social Security is 5% of GDP, going to 6%. It's a smaller growth, but that's 1 out of every 5 tax dollars in the future that's going to be going just for Social Security. When you look at health care, and when I say health care, I'm talking about the major federal programs, Medicare, Medicaid, the other federal health programs, that's projected to double from 5% to 10% of GDP. Well, that's $2 of every $5 of tax money. So just in those 3 areas, you're talking about eating up 80% of all federal tax revenue, and that's why the Deficit Commission was formed, because people look out and say, that's just unsustainable. We can't run the rest of the government on 20% of tax revenue.
Well, I have 2 thoughts on that. If healthcare costs are rising that much, and we just went through healthcare reform last year, that alarms me. But at the same time, what the Commission seems to be focused on primarily right now is the low-hanging fruit, which is Social Security. Why are they going after Social Security?
Well, that's a really good question, and a lot of people are asking the same issue. I think, you know, you can only speculate at this point. If I had to guess, I'd say just what you said. We just went through national health care reform. There's a lot of people who are saying, oh my gosh, you know, that was such a national turmoil, and Medicare and Medicaid are so complicated, and there's so many different things you can do that people don't understand. I think the Commission is a little bit reluctant to get too deep into it. Social Security reform ideas have been around for a long time. There's a very specific list of initiatives. You know, nobody's been able to agree on them, but at least they know if you do this, it saves that much. If you do that, it saves that much. I think they're looking at that as something that when you put the hierarchy of all these big federal entitlement programs, what's the simplest to deal with?
It's more predictable.
It's a little more predictable. You know, it's the least touchy of the third rails, you know, if you want to look at it that way. Whether it goes through or not, I don't know, but these are big, big deals, and I think when you hit the issue, the real gorilla in the room is healthcare, and if you want to get serious about reducing the national debt, you're going to have to do something a lot more significant on Medicare, Medicaid, care for children, federal and military health care, those kinds of things.
That's our next topic, right?
That's going to be a big topic. That's going to be big battles over the next 2, 3, 4 years, I think, just because it's so much money and it's so complicated. And that's what we'll be looking at next.